Hi there, welcome to another episode of Health with Dr. Yvette Massacre. This is a podcast that aims to correct myths around health. Today we'll be talking about fibroids, and I'm joined by my good friend, Dr. Namunji Matali. I'm sure most of you remember her. Thank you for joining us.
Thank you so much for having me. It's good to be back.
Good to have you. So tell us, what are you up to?
Okay. Okay. What
What
am
are
I
you
up
up
to?
to, as
Doctoring.
yeah.
Yeah. My
Doctoring.
full-time job. Yeah. Outside
Uh-huh.
of that, nothing much, but mostly, working in the hospital
Okay.
and doing things like this.
Yeah.
Yeah.
Mm-hmm.
Yeah.
And what's up with
Okay.
the RDAZ?
Okay. So about RDAZ, July is Fibroids Awareness Month. So we as Resident Doctors Association would like to do our part in spreading awareness because fibroids are a very common problem, more common than most people think or would want to think. So we decided to team up with Dr. Yvette to just get the word out there on the important stuff. Yeah.
Yeah. So that's what's up. RDAZ and Dr. Yvette talking about fibroids and the
Yes.
Fibroid Awareness Month.
The way we're talking about them as if they're a nice thing, but anyway,
No,
it's important
they're not.
that we discuss the hard stuff.
We're just trying to discuss them in a fun way and not a depressing way, but
Exactly.
they're not good things.
No, they're not.
So as usual, we have to define what fibroids are.
Okay.
So what are fibroids?
So fibroids can be defined as non-cancerous growths of the uterus or the womb, if you like. These tend to originate from a part that we call the smooth muscle. And yeah, they're non-cancerous. So most women who are in the ages of about 30 to 50 and black have a high chance of developing fibroids. They say 20 to 80% can develop fibroids, especially if you're in your reproductive age group and you have black origin or you are born from black parents. Very likely you have or will develop fibroids.
Yeah. And as she said, fibroids are non-cancerous growths. So these okay, I'll call them tumors. So these are tumors that feed on estrogen, a hormone called estrogen that most of us who haven't hit menopause, we produce estrogen. So when you get pregnant, the more dominant hormone is progesterone.
Exactly.
So in short, what I'm trying to say is if you don't get pregnant, it means that you don't have a break from producing that estrogen. So it means that you keep on producing food for the fibroids.
Yeah.
So getting pregnant is protective against fibroids.
Yeah.
Yeah. So what are some of the other things that put people at risk of fibroids?
Okay. So I'm glad you've talked about the whole estrogen factor. Just on that part, having started your menses early, that accounts for early exposure to high levels of estrogen. So if one started their menses very early on in life, that's a risk factor. And also having later menopause, later than normal menopause, because you're increasing the time under which you are exposed to the same estrogen hormone that you're talking about. And then also some studies have shown a link between hair relaxers and developing fibroids. Like I said, some studies.
Yeah.
Yes. And like you mentioned, not having a baby or what we call nulliparity can be a risk factor for the same. Having a BMI or being obese, high BMI, sorry, or being obese can put someone at risk of developing fibroids as well.
Yeah. I'm sure people are wondering, like, why obese people? So studies have shown that obese people produce more estrogen than people who have a normal BMI. So if you're obese, we always encourage you to try and work on it. I don't like talking about this because people get, all defensive, like, it's easier said than
We're
done.
not fat shaming anyone, but we're not going to sugarcoat and cushion anyone at the same time. It's important for us to state things as they are.
Yes.
Yeah.
So,
and if you've noticed, obesity is a risk factor for so many conditions, for so many different conditions. So diet and exercise actually help prevent many different conditions. If people think about it that way, they'll stop feeling that kind of self-stigma to say, oh no, why are you attacking me on my weight? It's not an attack. It's more of just, encouragement to say healthier weight keeps you away from some of these things.
That's true.
Yeah. So, like you've rightfully highlighted, so many different risk factors. We start with women of reproductive age group, women who underwent their first menses earlier on in life, and those with later menopause, not having been pregnant or what we call nulliparity. Some studies may show a link between hormonal replacement therapy.
Yeah.
Yeah. Basically increased
contraceptives,
exposure to these estrogens, like you said. Some studies have also shown a link between hair relaxers and the development of fibroids. And like you rightfully said, even obesity is a risk factor for the same. Yeah.
Yeah. So those are some of the risk factors. And I know people are asking, how can I know that I have fibroids? Like, what will happen to my body when I have fibroids?
Okay. So not all fibroids will cause symptoms, funny enough. You may have little ones sitting in your womb that are not causing you problems and you're living your life just fine. But most people show up at the clinic when they've actually started developing symptoms that, would trigger certain things. For example, irregular menses. You find someone has very heavy menses, heavier than normal. Their periods are normally painful, like very, very painful periods. And on the pain factor, please don't be strong through the pain and say, no, I'm a woman, I can push through the pain. Pain is a sign of things sometimes not going right. So don't get comfortable with just swallowing that Panadol every single time you feel this pain in the name of, oh no, I'm a strong woman, I can push through it. It's okay to experience pain and have it treated. There's no shame in having pain treated or getting to the hospital to say what's causing this pain. So painful periods, a painful pelvis, if we like, or the lower belly tends to become painful as well. Infertility can also be a sign of having fibroids, because you know that when a man and a woman meet and that egg is fertilized to form a baby, it's supposed to sit in the uterus or implant in the uterus. But now if you have fibroids blocking where this baby is supposed to sit, very likely you won't have the baby grow.
And sometimes you actually find that the fibroid can compress on one of the tubes.
Exactly.
And so the sperm will not swim up to the egg.
Exactly.
Yeah.
Exactly. So fibroids can cause infertility. And the funny thing though is you can be pregnant and have a fibroid at the same time. Though fibroids can complicate your pregnancy. So if you know you're a woman living with confirmed fibroids, like they were confirmed on a scan or by your doctor, and you've fallen pregnant, it's important for you to go to your nearest health facility so that they follow up your pregnancy from start to finish, because fibroids can complicate pregnancy. The pain, the bleeding, there's so much that can go on.
Yeah.
Yeah.
Especially the pain. If you have fibroids and you get pregnant, expect the pain, because as your womb grows, your womb starts compressing on the blood vessels that supply the fibroids. So the fibroids will not be receiving enough blood. So they'll start dying, and that dying will cause the pain. So if you have fibroids, yeah, you may have a painful pregnancy.
Yeah.
Yeah. And and you may have to deliver by cesarean section, depending on where your fibroids is sitting. Because there's some women where the fibroid just sits right on the cervix. So meaning it's blocking the way for the baby. So you have to deliver by cesarean section. And most likely your next baby will also be a cesarean section. But sometimes we do remove the fibroids if we can during the cesarean section. Yeah.
As long as they don't look like they'll bleed.
As long as it won't complicate anything.
Exactly.
Yeah.
But having fibroids in pregnancy does not equal C-section. It varies from one woman to another. And also, don't look down on C-section. It's a life-saving procedure. Don't think of that mentality where people say she's too posh to push or she's not woman in.
It's
It
not
is
woman
a
enough.
life-saving procedure. When
It
your
is.
doctor recommends a Caesar, it's to save both mother and baby.
That's true.
Exactly.
Yeah. Then some other symptoms that you get. So because you're bleeding a lot, you're losing a lot of blood. So you may have symptoms of anemia.
Exactly.
You may feel your heart pumping very fast, palpitations. You may have dizziness. You may, what else is there? You may get tired easily.
Easy fatigue, yeah.
Yeah, such as
Sometimes you can
symptoms
even
of
feel
anemia.
breathless depending on how severe the anemia is.
Yeah, because severe anemia can affect your heart, which can lead you to have heart failure. So anemia is a very serious thing.
Exactly.
Yeah.
And another symptom of fibroids, especially when they've grown a lot, easy satiety or, easy fullness, so to speak. You've eaten a small meal, but you're feeling full so easily because, it's starting to fill up your belly and push the organs around, almost like a pregnancy. Some of them grow as big as a pregnancy.
Even bigger.
Even bigger, you
Yeah.
can have even a 6 kg fibroid. So they can be quite severe and quite a nuisance almost. Yeah.
And just as you've said, because they're putting pressure on so many things, you may find that you're getting constipated because the fibroids are putting pressure on your rectum.
Yeah.
So you're not easily passing stool. You may find yourself going to the toilet frequently to urinate because it's compressing on your bladder. So your bladder is not getting as full as it can.
Yeah.
Because the bladder can be quite big.
Exactly.
So you end up going to the loo frequently. And some people actually are predisposed to having UTIs because of fibroids.
Yeah.
Yeah. So then if you have a UTI, it means that you're going to have, pain when urinating, a burning sensation, all those things.
Very inconveniencing.
Yeah,
very inconveniencing.
Yeah, so those are some of the symptoms
Exactly.
Then when a patient comes to you, what will you do for the patient? How are you going to investigate the patient?
Okay. So normally when a patient comes, there's what we call history taking. I won't send a patient straight for a scan all of a sudden. I need to get what it is that they're complaining about. Have you been having pain, irregular menses? Have you had a baby before or not? When did you start your menses? At what age? Are you a person maybe who's had cancer before, like breast cancer, and maybe there's hormonal replacement therapy going on somewhere? So we typically get an adequate history, which kind of points us in the direction of how we should investigate the patient. And then, of course, we have our imaging, what we like to call imaging, where you send your patient for a scan, which will give us a nice look into the womb to see what exactly it is going on. And, we'll be able to tell on the scan even just the position and the size of the fibroid. Then we take it from there. Now, some people believe a certain myth that all fibroids must be removed by surgery. That is not true. Not all fibroids are removed by surgery or need to be removed by surgery. One thing I've noticed a lot of obstetricians follow is if they're not troubling you, leave them. So you can find that you have tiny, tiny ones, maybe even 2, 3, 4, just sitting in your womb. But you've had your babies, you're fine, you're healthy, they're not doing anything to you. We leave them alone.
Yeah.
Because the issue with fibroids is they bleed. But now when it becomes a problem, like, these fibroids are growing and growing, they're growing to the size of a pregnancy, they're inconveniencing you. Maybe you want to start a family and you haven't yet started a family. That's when we consider other treatment options. Sometimes if a person has to undergo the surgery route, we could give them certain drugs to shrink them for a limited period of time.
Yeah.
And then when they're an appropriate size where they can be removed, they're removed. And then for women who you find that, maybe they've had all the children they want to have, and these fibroids just keep coming back and they come back bigger and better than they were before. For some, it's an option to remove the fibroids, or depending on what the patient decides, they can actually remove the entire womb. Because we've had patients before who have like a fibroid the size of 2 babies, 2 big babies, and it's an inconvenience. I mean, you can imagine walking around with a tumor that big. It's finishing your blood. It's causing you to be anemic. probably even your bulus are saying, she's pregnant again, but there's no baby. And you're just failing to tell them that, no, it's not a baby,
Yeah.
So really, there's no one size fits all treatment. We manage it from person to person.
Yeah, that's true. So, when it comes to surgery, one of the problems that we faced with people who have fibroids was getting their blood up.
Yeah.
Because sometimes they come with blood levels of, let's say, 6, very, very anemic, and you can't take someone with an HB of 6 for surgery, because the fibroids may bleed. So if they're at 6, they may even bleed more.
Exactly.
And then you drop them to like 4. So we always try to get their level to be above 10.
Yeah.
And it takes a lot of work.
It does.
Because in as much as you are giving them, we give them blood boosters, yes. So we also usually we give them combined oral contraceptives to sort of, sometimes we try to stop the period.
Yeah.
So at least 1 month you don't bleed. And sometimes we actually just try to regulate the period. If you're bleeding more than once a month, we just try to regulate. So you can imagine this person is taking blood boosters, but they're also bleeding. Heavily bleeding. And
it's
this
a nightmare.
And this is a person you want to take for surgery. Oh my God.
It's a lot.
Yeah. So every time you have to check their blood level, and once you hit the blood level you need,
you jump.
And you don't waste time. You just
exactly
go for it and remove the fibroids or remove the uterus. Sometimes we do a procedure called
myomectomy.
Yeah, a myomectomy. So there are two things. Either we do a myomectomy where we just remove the fibroids themselves.
Yeah.
Or there's what they call ablation, where they sort of crush the fibroids, like destroy them. Then there's a hysterectomy, which is removing the entire womb. Some facilities do what they call uterine artery ligation.
Yeah.
So this is where you cut the vessels that are supplying blood to the fibroids.
Exactly.
Or you block them with something.
Yeah.
So those are the surgical treatment options. Then for the medication, as you rightly put it, we give the gonadotropin releasing hormone agonists. Those are the ones that kind of shrink
the fibroids.
Yeah, because they reduce the amount of estrogen. So they basically put you in menopause, basically.
We wouldn't really call it menopause, but
something a state like menopause. Yeah, they put you in that state,
a physiological kind of menopause.
Because as someone approaches menopause, or when they attain menopause, the fibroids shrink on their own because automatically their estrogen has exactly. Then we also give the painkillers,
of course,
the NSAIDs. Those also help with reducing the pain and also reducing the bleeding. And we have things like tranexamic acid also help
to stop with the bleeding. As you've talked about anemia, I love to always divert attention to one important thing. You even know where I'm going with this. Blood transfusion. There is a role for blood transfusion if someone is severely anemic. The normal blood level hemoglobin for a woman is at least 12 to 14. So there's different levels of anemia. It's not like if your HB is 11.9, you need a transfusion.
No.
But a level such that your body is failing to function as should, your heart is being overworked, you're working overtime to just, oxygenate your body the way you're supposed to. So typically when someone's HB is below 6, below 7 for some people, even 8 for others can cause like what we call symptomatic anemia with those symptoms she talked about of racing heart, easy fatigue, labored breathing. It comes with a lot of these complications. So when someone is severely anemic, there is a role for blood transfusion, and it's life-saving. And also it facilitates the same surgery that needs to take place in the event that there's need for that surgery.
Yeah, and there's need to also educate people on the importance of blood transfusion. I hear a lot of people complaining in the hospital, like, oh, the blood bank doesn't have blood. But have you donated?
Yeah.
Like, we
Yeah.
always ask people, tell your relatives to come and donate. You only understand the importance of blood transfusion when you are in the hospital. When you're out in the community, you're not thinking about it. But when you come to the hospital, you're like, oh, there's even blood transfusion,
Exactly.
So tell your friends to tell their friends to donate.
Please,
Save a life.
Exactly.
Blood transfusion can really save a life. Yeah.
Yeah.
And there's always something about blood transfusion happening quite often.
Yeah.
It's always like a walk, a match, they always set up in different places.
So I'm glad you've mentioned it again. So as Zambia, we will be celebrating World Blood Donor Day on the 15th of August, this coming August. So every year we celebrate the donation of blood all throughout the world. WHO, coined a day to celebrate blood donors because they save lives.
They do.
So for this year, the theme is celebrating 20 years of giving. Thank you, blood donors. So you can imagine we've been celebrating blood donations for 20 years. And we're just trying to shine a light on the people who are unsung heroes. Because, when you donate blood, when you go there, when I go there, when other people go there, sometimes you never even meet the patient who's going to receive it.
You never.
But you find this woman who was dying during childbirth because of bleeding excessively, goes home with her baby. And this child will get to have their graduation in university and take a picture with their mother because of one selfless act.
That's true.
Yeah.
And let me just mention this. We don't force anyone to donate blood.
No.
We don't force anyone to receive blood. So if you're not comfortable with it, just tell us no.
Yeah.
You sign and that's it.
Yeah.
So we don't force anyone.
We respect patient autonomy.
I know people are going to come in the comments and say, oh no, blood transfusion, what. We don't force.
Actually, there's nothing that is forced in medicine. Everything someone has to consent to.
Yes. Someone has to. Either the patient, if the patient is not in a state, the next of kin can consent. So if you don't want blood, we won't force you to have the blood.
No, we won't.
Yeah.
Yeah.
So, Dr. Namunji.
Yes, please.
I think we've covered the main issues about fibroids, and I hope there's someone out there listening to us and would decide to go to the hospital because they failed to have a baby. But also, if you're struggling with fertility issues, come with your partner.
Don't go alone.
Yeah,
it literally takes two to tango.
Yeah, it's not always the woman.
Exactly.
Yeah, so men out there, if you're struggling to have a baby with your wife or your partner, it's not
a one-sided thing always. It can be both of you or it can be either of you. So it's better they go together.
Yes, please go together. And I know someone out there who will be asking their wife, are you sure you don't have are you sure you don't have fibroids? Because I heard these two doctors talking about it.
Fibroids.
Yeah. Maybe it's the fibroids. Maybe it's your semen.
It could be
Who
anything.
knows? So both are supposed to be checked.
Yeah.
Yeah. Actually, one of the investigations that we do sometimes if you have infertility, whether it's because of fibroids or not, is I don't like this word, a hysterosalpingogram.
Yes. A very long word that just brings back memories of med school for me.
Yeah. So basically what this investigation does is that it checks the patency.
Tubes.
Yeah. It checks that your tubes are open, and it also checks for the fibroids inside the uterine cavity.
Uterus,
yeah. So basically they put in a dye. They inject a dye, and the dye goes into your tubes, in the uterus, and into the other tube, and we take a picture.
And it shows the outline.
And it shows the outline of your tubes and the uterus. And if we notice that there's anywhere where the dye wasn't passing, then there's something happening there.
Exactly.
Yeah. I just thought I should mention that.
Yeah. The more knowledge people have, the better.
Yeah, so that they can make informed decisions. Yeah. So thank you so much for joining me today,
It's
talking
always a
about
pleasure.
this important topic. Yeah.
Thank you.
And I hope that it means something, that it's also coming from women.
Right. So please
Yeah.
remember, if you experience any of the symptoms we talked about, irregular menses, this pelvic pain, sometimes even lower backache and the like, maybe you're struggling with some infertility here and there, easy fullness, or you start to even look a bit pregnant because your belly is growing.
Yeah.
Please,
You may think that, oh, I've gained weight. Maybe it's fibroids.
it
Who
could be
knows?
fibroids, yeah. So do visit your nearest health facility, not Dr. Facebook, Auntie Who on Facebook,
Auntie
Neighbor Who
Google.
on Facebook. Go to the hospital.
Yes. So guys, don't forget to subscribe and like the channel. Bye.